Thank you, all of you, for the honor of being here, for the opportunity to present the work that my colleagues and I have been doing, including working with colleagues at Genesis Rehab Specialists. I want to thank the organizers of the conference because whenever I have the opportunity to be in China, I learn a tremendous amount, and I certainly learned a great deal yesterday. Unlike the other session today, I am not going to be talking about technology. I'm going to be talking about a programmatic application that Karen Burdick referred to. If I can get the slides to move. There. And it's an innovative program. It's an innovation in health professions, though it's not technological. As Karen said, we were asked to work with GRS to develop an assessment of the health coach program that they had created. Everyone yesterday made the case that there's new health professionals required in China. I was gratified to know that the information I have, which I used to convince my US colleagues of this need, was reinforced by all of your eloquent comments yesterday. I think that the health coach is someone who responds to a number of the issues that were raised by everyone who spoke yesterday. The need to have community support, the need to promote wellness and to promote prevention for non-communicable diseases, for care outside of the acute hospital setting. And I'll describe a bit about what we've done to accomplish that. But first, I'd like to talk about a topic that we really haven't covered much in this conference, and that's the notion of assessment, of evaluation. When we speak about evaluating people, we call it assessment. When we talk about evaluating, we call that evaluation. And in fact, we're always evaluating. We are constantly being evaluated. Last night at our dinner table, we were talking about how wonderful the meal was. We were evaluating the meal. This conference is terrific. We're evaluating the conference. So assessment becomes a very important component as we're working to develop new educational strategies to promote new kinds of healthcare professionals. And there are different things that assessment can accomplish. Obviously, we can evaluate or assess a person's knowledge. We can do that with the kind of questions that Karen Burdick was describing, multiple choice questions. We can assess someone's skills, simulations, standardized patients. We can assess attitudes, bias about certain things, how you feel about an ethical situation. And obviously, we can assess performance. We have competencies that we use to promote our educational programs. We define the competency that we want for an individual, and with an assessment, we can assure that anyone who passes has reached this minimal level of competency. And at the same time, we can define what aspirationally we want someone who achieves 100% and does absolutely their best on an assessment. We can define our aspirational goals. And perhaps most importantly, we have a saying in the United States, we inspect what we respect. An assessment defines what we value. What's included in an assessment says this is important. If it's not in the assessment, it may not be considered important. So why is it important to have a national assessment, something that would be across an entire region, an entire country? As Dr. Nora presented yesterday, it's very important for professions to define their values, to define their standards. By having a national assessment, we can assure that the standards that this profession has defined are being met, are being assessed. Assessment, and a national assessment in particularly, drives teaching and learning. It defines the curriculum because it says this is important, this is less important. An external audit, something that is transparent and provides accountability. A national assessment allows you to compare the performance of your students against every other student in the country who has taken this exam. It's a very important measure of accountability. Interestingly, assessment can also provide a safe environment for the very kinds of innovations we're talking about at this conference. How do we know that what we're trying to change, that what we're trying to do is having the impact, is making the difference that we're trying to promote? We can do this by assigning metrics and measuring that. The NBME is 102 years old. Now, I know that is not very old for China, but it is for the United States. And in the course of those over 100 years, we've learned a great deal about the impact of assessment. And one of those is that if you change an assessment method, that will have a greater impact on learning and outcomes than a change in curriculum. Introducing an assessment has a huge impact on the success of a teaching exercise. Assessment methods, standardized patients, computer-based, paper-based, simulation, whatever method you use has an impact on the way that students study, and it has an impact on the way that faculty teach. The assessment method characteristics, the metrics that you choose to use to define what success means, are very important. And finally, assessments must have consequences. It has to count for something to be valued. So now I want to talk about the health coach examination. And I'm representing a large group of people who have worked on this activity. We're very excited by the prospect of being able to move forward with what we hope will be a national assessment at some time, in part because since this is a very new health profession, it's going to provide us the opportunity to collect data, to be able to see if this new health profession has any impact on the health of people in China. It also will be a measure of assuring the public as well as employers about the quality of this health profession. Obviously, measuring the skills and knowledge of the health coaches will provide credibility for the profession. Have they met the standards that the profession is setting? And working with the people who are providing the curriculum, it'll give us the opportunity to look at where there might be gaps in the educational program, where we need to improve things. The idea for the health coach is that this individual would take a foundational level exam, and that over the course of their career, they would have the opportunity to take other exams to a mastery level and ultimately be recertified, a concept that Dr. Noor described yesterday. So I want to tell you a story, and I'm going to start with a secret. And that is that we had no idea what we were doing when we started. This was a new concept. There is a concept of health coach in the US, but this was brand new. We brought a group of people together and said, we want to create an exam, but we don't really know what it's going to be about or what this person is going to do. So the first thing we had to do was bring together a group of individuals. They were nurses, US-based health coaches, Chinese subject matter experts in Western medicine, as well as TCM, health coaches, nurses, and other social workers, people who work with patients all of the time. And because we were trying to define someone who is really a health advocate, someone who can promote wellness. And we brought this group of people together for 2 days. They created a whole list of topics, and then we sent that list to a much larger group, same representation, and asked them to tell us what was missing, what needed to be changed, what needed to be added. And ultimately, we came up with this blueprint, which covers 5 major areas. Our focus now is on geriatrics, but that will change as the population changes. Wellness and well-being, communication skills, our most difficult, ethics, morality, and professional conduct, and finally, the healthcare system, operating in the healthcare system. These are several of the topics that are included in the examination: communication and relationship building, motivation and activation. How do you motivate someone to lose weight, to stop smoking, to manage their diabetes? This is a sample of the kind of questions that are on the exam. There are 150 items, and I have other examples that I can share during the break. These questions are presented as vignettes, short stories about the person who is presenting. And then there is a question that is asked, and the examinee must select the single best answer. And you can see that these are not facts. This is not a regurgitation of information. This is the individual determining, how would I manage this person? What would I ask them next to encourage them to, in this case, it's a woman who doesn't want Western medicine. The health coach needs to understand why that is and what she can do then to promote the health of this person. So we administered a pilot exam in December 2016. There were 424 examinees. They included physicians, nurses, and other healthcare professionals. As Karen described, they all participated in the online curriculum that Genesis Rehab Specialists provided. I had the opportunity to speak to a number of them both before and after the exam. And many had taken the exam not because they intended to be health coaches, but because they wanted to improve their ability to communicate with their patients. They wanted to have a better understanding of wellness and health promotion. We administered the exam in 4 cities in China: Beijing, Guangzhou, Hangzhou, and Shanghai. And when I was talking about assessment earlier, I talked about the importance of understanding how we would know if we were successful. So we hold 2 sessions following the administration of the exam. One is to determine if the questions themselves are valid. Was there a mix-up in understanding of a question? We do something called key validation. If 50% of the students answered A and 50% answered C, we know there's a problem with that question. There was a misunderstanding, or the key, the answers available are incorrect. So we held the key validation with Chinese nationals, with people who had helped write the exam questions, and we ended up deleting 14 of the questions. Then we held what we call a standard setting exercise. It's very important to understand that the standards are for China. NBME does not set the standards. China does. And the standard was set at 55%. And so 31 people did not pass the exam, but that represented a very low percentage. And I can explain the standard setting exercise, but it takes a long time. All of the people who passed the exam received a certificate of completion. Our next steps are to assure that the terms that are used on the exam are the same as those used in the curriculum. We are in the process of developing a second form for a second pilot, which will be in November this year, and creating additional practice test items and tweaking the exam as we go. So I look forward to further conversation, to your questions. Thank you very much.